Hello, my name is Dina McNeil, and today we're going to discuss insomnia in cancer survivors. I am a nurse practitioner from the VA in Puget Sound in Seattle, Washington. The impact of insomnia is really great on cancer survivors. It's one of the most common complaints that we hear and occurs in about half or 50% of cancer survivors. Lack of sleep can indicate and cause significant distress, whether it's the cause or whether it is the aftermath of lack of sleep. It can occur in the years during treatment and the years post treatment, although in years following treatment, it usually improves with time. Insomnia includes issues and trouble initiating sleep, as well as difficulty staying asleep. All of these are known to cause a decrease in the quality of life and affects compliance with cancer therapies. And that would be things surrounding our health, like eating healthy or getting some exercise. Nobody really wants to do that if they don't have the energy for it because they're tired and fatigued, even more so than what treatment has cost because they just can't get a good night's sleep. It can also lead to other physical and mental health issues as well that we'll discuss. Why can't I sleep? This could be something as simple as I'm in pain, I'm worried, I'm anxious, I've got health issues, I've got financial issues, as well as treatment side effects such as diarrhea and urinary issues. All of these things can interact and cause some complex sleep issues. These don't have to just appear in isolation. You could be experiencing one or all of these things that can interfere with sleep. What can I do for sleep? So, things that you can do at home, one of the most helpful things that would help your healthcare provider get to the bottom of what's likely causing your sleep disturbances is to keep a sleep diary or log or a journal. Note what time you're going to bed, how long it takes you to go to sleep. How many times did you wake up and for how long? What time was it? Are you waking up at 2 o'clock in the morning every night? Maybe that is a significant time for something that once you start discussing with your healthcare provider can help problem solve. The total hours slept per night is important. How well did you sleep? Did you feel rested? Did you not feel rested? Is this something that occurs every night? So having these sleep diaries and journals really helps look at things over a period of time to help come to maybe some consistent reasons why you're not sleeping or not sleeping well. Substances such as caffeine, alcohol, and tobacco are really things that you want to avoid at bedtime. Caffeine, you want to stop earlier during the day so it doesn't affect your sleep. And exercise, not getting enough exercise can also create issues. Medications. That's something that a lot of medications have in their side effects that they can cause sleep disruption or insomnia. So maybe it is the time that we take medication so it doesn't interfere with sleep. Those are also things that your medical provider can look at and say, okay, we know that this medication can cause issues with sleep, so maybe we can adjust the time. That's something that may or may not uh, be able to do, but definitely something to look into. Naps. People who are tired, they want to take naps. When you take naps during the day, it can affect the way that your body interprets the time that it should go to sleep. So, making sure that you're getting enough rest is important, but getting into a cycle where we're having a 4 hour nap in the middle of the day and then that's pushing off bedtime until not going to sleep in the middle of the night can really cause some issues. So all of these things are things that are looked at when people are having trouble sleeping. That is really important to talk to your healthcare provider about for a solution. The effects on physical health. Our body needs rest to be able to fight all of the various things that we come in contact on a daily basis. Inflammation, infections, lack of sleep really affects your immune system, so it's not functioning as well and as optimal as it should be. Elevations in blood pressure, irregular heartbeat, those are things that people may complain of palpitations or headaches and not realize that they're having irregularities in the way that their heart is beating or an increased blood pressure. Um, Also, heart disease and heart failure. We need rest for our bodies to be able to function and react appropriately to stress, and our ability to fight off things and stay healthy. That's really important when we're looking at sleep as it affects mental health, because our body is in a constant state of use and repair. So this is something that we definitely need to look at to make sure, am I doing everything I can to make sure that I'm not putting undue stress on my heart or undue stress on my vessels by having elevated blood pressure and tired all of the time and can't sleep, because this also can affect your cerebrovascular health as well. Um, Higher incidences of stroke in those who have insomnia and do not sleep well. Stress hormones. Your body releases stress hormones, a stress hormone called cortisol, which high levels of cortisol have been associated with elevated blood sugar that can result in diabetes and also affect appetite as well. Effects on mental health are pretty significant. And again, this is kind of a chicken or the egg thing for some. Depression can cause insomnia, anxiety can cause insomnia, but also lack of sleep, lack of adequate or quality sleep can also be a cause of depression or anxiety. So, those are things that you would want to talk to your healthcare provider about as well. A sleep diary or log can be found on the sleepfoundation.org's website. Here at this address, sleepfoundation.org backslash sleep dash diary. And this is a great tool to use to give your provider a good idea of how your sleep is going and the things that could possibly be affecting your sleep. Treatments. Good sleep hygiene is really important. I would say this is probably one of the most important things that you could do, is making sure that you're doing everything that you can to make sure your surroundings are preparing you for a good night's sleep. Relaxation therapy is another beneficial tool that we can use to get a good night's sleep, as well as cognitive behavioral therapy, medications if you're a candidate for that, as well as consultations with sleep medicine specialists if the all of the above is not effective or you have indications for it. So sleep hygiene, really important to go to bed and wake up at a consistent time. That's really important because your body, you want to make sure that your body is knows this is my bedtime, this is a routine, and this is what time we're going to go to sleep. The more consistent time that you have for going to bed and waking up, that gives you better chances of having a good quality night's sleep if you've addressed the other issues. Room quiet and dark at a comfortable temperature. It's really uncomfortable to sleep when it's too hot. Some people can't sleep when it's too cold. Just make sure that it's dark and a comfortable temperature where you can go to sleep. No screens. This is super important. Cell phones, tablets. You've got the news in our face. We've got people calling. Put your phone on do not disturb. Turn your tablets off and take away that stimuli so you can actually relax and go to sleep. Daily exercise is beneficial for sleep. It's really important that as a cancer survivor that you are getting daily exercise as tolerated. And you want to avoid large meals before bed. And again, caffeine, alcohol, and nicotine, all things that really can disrupt sleep. Relaxation therapy includes things such as diaphragmatic breathing, meditation, progressive relaxation, biofeedback, and imagery. Diaphragmatic breathing and meditation. We have some really great videos on the VA YouTube channel that is under the Cancer Survivorship Seminar Series that have some great breathing exercises and mindfulness meditation. They have some that are longer and some that are just kind of a 10-minute check-in, which is really good to get in the habit of doing and kind of teaches you how to do that on your own and guides you in learning this skill. Progressive relaxation, that's kind of doing a head to toe check-in and just as you're imagining your shoulders, you're relaxing them and letting them sink into the bed, and you're doing kind of a head to toe scan, noting any areas that are tense and relaxing those areas to prepare you to go to sleep. Biofeedback and imagery. Those are things that can be discussed with um, medical health professional or some sleep medicine will also work with imagery. But these are all things that can improve sleep. Cognitive behavioral therapy is something that is performed by a therapist or psychologist and can change negative thoughts into thoughts that are more positive. And this can be something such as, I have anxiety before I go to sleep because I can't sleep, or maybe there's just too much to do in a day and I have to get everything done before I go to sleep. So there's lots of issues surrounding sleep that people can have. Anxiety and depression, as we talked about earlier, can cause sleep issues, or they may be a result of sleep issues. So exploring and changing the negativities that we feel surrounding sleep and turning them something into what we look forward to, laying down and getting a good night's rest can really be beneficial. And this is also a great option before we think about initiating any kind of sleep medication if you're a candidate for that. Medications that can help with sleep, again, this is going to be from person to person, and this is dependent on what medications you're currently on, what health conditions you have, what how this medication would affect your condition and other medications you're taking, and is this safe for you? Medications include something like melatonin, which is something you can get over the counter. And that is something, again, we don't recommend taking anything unless it's discussed with your medical provider. Sedating antihistamines such as Benadryl, sedating antidepressants, that would be something like mirtazapine. Mirtazapine is actually an antidepressant that, when used in lower doses, can really help in initiating sleep. Also, a side effect of this medication is that it increases appetite, which could really be a benefit from those going through cancer treatment who really have a poor appetite and aren't sleeping well. Sedative hypnotics. Now we're looking at higher risk medications and benzodiazepines that can cause respiratory depression, especially when mixed with alcohol or opiates or other things. So this is something that you really want to make sure that you're looking at all of the things before you initiate this, and talk to your provider about risk of dependence and the dangers of taking these medications, and weigh those risks against the benefits of taking them. Thank you for your time today. Please enjoy any of our other cancer survivorship seminars on the VHA YouTube channel. Thank you.